You might recognize actress Megan Good from movies including Think Like a Man and Anchorman 2. Megan joins us now with Dr. Jason Champagne to share the results of a new cosmetic treatment. It's an eyebrow transplant. Megan, thank you for joining us. We really appreciate it. Now, before we get started, I do want to just share a picture of you before you had this transplant for everyone to have a little comparison. And certainly, for my untrained eye, quite a remarkable difference.
Oh, yeah.
I mean, that
nice brows.
Very nice brows.
I actually like the way the shape was modified a little bit. It really frames your face.
Yeah, the natural shape of my brows before I went through the whole 90s debacle were actually very straight. So when we talked about the procedure, I was like, I would like a little bit more of an arch. And so he was able to tell me what made sense for my face and get it pretty much exactly what I wanted. Yeah.
So when did this start becoming a problem for you?
When I was about 15 is when I started to pluck them. And then by the time I was 19, you know, in the 90s, the brows were like, there you go. I was 16 there. The brows were like super, super, super thin. And by the time I was 19, they stopped growing back. And then by the time I was 25, I decided to tattoo them, which at first was okay. But then like any tattoo, the thin line ultimately starts to bleed. And when it bleeds and they're so close to each other, they start to become a block. And so after that, I microbladed and still the same result. And so I kind of was stuck with, I have no idea what to do now. And moving into my 30s, for me, it started to look a lot harder on my face and it made me look a little aged, so.
Well, that's why you always tell people never pluck their brows, right?
Well, so many of us. I think there were a lot of women in the audience, including me, who were listening to him. We're all nodding our heads because we all over-tweezed. And when you traumatize the follicle, it just doesn't grow back.
And then
you
you
have
never
these little
know.
patchy spots.
Exactly. And you never know what the next years are going to be. And so I had no idea. I had no foresight that it was going to be like a thick, kind of bushy brow. And so keeping it as natural as possible, I think, is the safest way to go for anyone.
So, Dr. Champagne, in this case, how did this procedure work?
So the procedure is done as an in-office procedure. No general anesthesia. I harvest hair from the back of the head. It's the best place typically to borrow hair. And then take those hairs under a microscope and divide the follicles one by one into single hairs, and then transplant those into the eyebrow into the shape that best balances with that patient's facial structure.
You are a hair restoration expert, and I mean, you do it for various reasons. Obviously, the number one being hair loss for men, but this is a new and a little bit outside the box application of it.
But it's a wonderful application for patients who are looking to improve their brows, enhance their facial features. Thicker, fuller brows are in, and this is the way to go.
Yeah. And just so our audience is clear, when you transplant scalp hair to the brows, it continues to grow like scalp hair, correct?
It does.
So, Megan, you have to trim your brows?
Yeah, every couple of days I trim them, but the great thing is if I want them to be a little bit thicker and fuller, I can do that and trim them every 3 days. If I want them to be a little bit thinner, I can trim them every day or two. But for me, it's been a complete game changer. It's given me like 10 years back to my face. When I'm filming, it was always an issue of like, man, we love her, but what are we going to do with her brows? And so for me, it's totally blessed my career. It's totally blessed my face. And it's one of the best things that I've ever done. So.
And they're there to stay, right, Dr. Champagne?
It's permanent, yes, it's permanent.
And I do want to ask you this. How much might it cost? What's the range for someone considering this?
Anything less than probably $5,000 for eyebrows is going to be careful with that, because there are some really bad results, botched results.
In that scenario, $5,000 case, how many follicular units are you transplanting?
It depends. It's going to be more of a procedure dependent on the patient, to be honest with you.
Well, it's probably because of the time, right? Because you have to take those individual units. You're not even doing micrografts with 2 or 3 follicles. You're doing them one by one.
One by one. So it's a very
time-consuming.
tedious process and time-consuming. I would say the procedure can take at a minimum 4 to 5 hours, at the most up to 8 hours, and I've done 1 or 2 before that have been 10 hours.
So it's an in-office procedure, but it is a prolonged procedure. But what's great is it's an option.
Right.
And, for someone like you, Megan, this was the perfect option, and you can tell how happy you are.
Super happy.
So, Dr. Champagne, good work.
Thank you.